Hello, I'm still Paul Kokety, and in this video I will be continuing to talk about the importance of massage in body work for pelvic health, in particular for sexual reproductive health. If you haven't watched my first video yet that I jokingly titled on YouTube, Why the World Needs Pelvic Massage, please watch it. It's very informative for setting up this video. But just in case you haven't watched it, I'll briefly summarize a few things. It mostly talks about how our asymmetrical habits create problems in our body, in particular our pelvis. How you lean to one side, how you always sit rolled on one hip, or how you always side sleep. Those create a lot of compression on that side of the body. In the pelvis, it deals with the hip bone getting compressed underneath the sacrum into the pelvic floor, creating a lot of tightness in the bottom musculature here, the pelvic floor muscles, and then how the internal organs get affected by tightness, compression, how they get dysfunctional. Obviously, it's easy to understand how if that takes place, then your sexual reproductive health will be affected by it as well. In the first video, I also talked about how the nervous system was affected by tightness, pulling, and imbalances in the sacrum, affecting all the way up through the brain and spinal cord, for treating a variety of issues like headaches, migraines, TMJ. This video, I will actually heavily be focusing on talking about the nervous system, but not the whole nervous system. I will be specifically talking about the impact on the autonomic nervous system, which controls the automatic functions of your body, like your resting, breathing, heart rate, digestion, and then down here, urination, defecation, and sexual reproductive health. So now the part of the nervous system that deals with that beneficial part to the reproductive health is called the parasympathetic nervous system. It is your rest and digest mode for digestion, your resting heart rate, and for sexual arousal. The parasympathetic nervous system mostly comes off of two parts of the nervous system. It comes off your brain and your sacrum. The other part that deals with the fight or flight response comes off of everything in between, so it's not directly a pelvic problem, so I'm not going to talk about that. For the arousal part, the parasympathetic nervous system, it comes off of the middle three levels of the sacrum. There's 5 levels of the sacrum, so levels 2, 3, and 4. The middle part of your sacrum deals with your sexual arousal, control of blood flow to the genitalia, stuff like that. So when you have a lot of injuries down here, or a lot of compression from bad habits, or a lot of tugging and pulling on things down here from being twisted out of balance, then those nerves can be affected. As I already hinted, for the genitalia, the parasympathetic nervous system, or the sacral nerves, they help with arousal down here, with sensation. The arousal increases blood flow to the genitalia. So in the case of the penis, it allows for it getting engorged to be erect. So when the parasympathetic nervous system is negatively affected, then guys can have erectile dysfunction. For women, you also have an erectile issue that gets dysfunctional. Besides erectile tissue being affected, the arousal helps your vagina relax. So if the parasympathetic nervous system is affected, then your vagina cannot relax as well to accommodate the penis. Your uterus cannot lift up a bit, so it can affect sexual gratification and also make sex uncomfortable. So very important for both sexes that that parasympathetic nervous system is functioning properly for healthy sexual fulfillment and ability to function. Let's see, other things affected regarding women is also lubrication for the vaginal. So too much dryness may be a problem in the parasympathetic nervous system down here. So very important stuff. Now, you don't really hear massage being talked about to help with this. Maybe you heard of going to a physical therapist for pelvic floor work, or maybe someone just tells you to do Kegels. But if you have compression and tightness and scar tissue here, Kegels are really not going to be of much of any good. So with massage, we can help change all this to help decompress the sacrum. We can do work to help release compression and tightness in the musculature, help your pelvis come into balance, and then also start to do scar tissue work to help release any way that might be binding on these nerves. Now, how we do this work and also how the problems manifest varies a little bit between the two sexes. Talking about men first, we have more compact pelvises because we don't have to go through childbirth. By being more compact, the benefit is we are more stable. So any way we are out of balance, if you get the right body work, chances are you will be able to hold better or longer in terms of that. The problem is we are more compact and stable, but we also have less mobility in here. And if you think of how movement helps to flush and move circulation through the body, or how stretching helps to do that, by the fact that there's less mobility in your pelvis, in a guy's pelvis, then we get more congestion problems and more inflammation can stay trapped in here. Of key importance there is for our prostate health, how our prostate can get inflamed. There's some very basic techniques to sink in from the front above the pelvis to get down around the bladder and prostate to release tightness there. Just releasing that congestion, it's amazing how quickly that prostate can shrink down to a healthier size. And I felt that in more than one guy. So for guys, it's about getting us into balance and then continuing to help to release the congestion that takes place there. And then also because we are less mobile, we trap more tension into the muscles here. So by doing body work to help keep those muscles relaxed, they will not tense up as much, which is important for the erectile muscles. The erectile muscles have to be able to relax to allow blood flow into the penis. For women, it's different. You have larger pelvises for childbirth. So to the benefit for you, you have more flexibility and more mobility in your pelvis to help with circulation, which isn't going to be important for your menstrual cycle. But on the downfall, you are less stable. So it's harder to keep your pelvis balanced. And a lot of the tightness in your pelvis is because of the imbalance, the torquing, twisting, how it creates compression in there and ongoing tightness. That is what we fight, and that's what we tend to work. So it's a little bit more preventive maintenance to help maintain the female pelvis. Where the tightness comes in with your menstrual cycle, that can be some of the repeated monthly trauma of that, creating ongoing tightness from that. But the other part of that is that imbalance, that compression, that tightness that takes place, that I hint at it here, and I talk in greater detail in my other video. So, two a little bit different pelvises, and then how the problems manifest and how we work with it is a little bit different between the two sexes. Now, in working with the pelvis, everything I do for the clients is always to your modesty and comfort level. I am merely a vessel to help facilitate healing in you, to help restore balance. I offer my knowledge. I can tell you what I feel going on and what I can do to help you. Ultimately, it's up to you to decide what is comfortable. Now, someone who's trying to decide if they're comfortable with the work or they're just not as if they're more modest, then I can do some general pelvic balancing work, external stuff with the hips, the thigh muscles, the glutes, the lower abdomen to help release tightness. And I have seen some pretty phenomenal changes there. But the deeper core work, the internal stuff, for the long-term benefit, the more in-depth I can get with the pelvic work, the more beneficial it will be. Yeah, the next step up from the big general techniques would be to start to do pelvic floor work. In the case of from the backside, starting to work with the musculature that's between the sitting bones and the sacrum, the tailbone. Basically, just inside the glute max muscle, your main buttock muscle, to start release tightness down here, and then to work up the sides of the pelvic floor, staying off the midline, to release inside the sitting bone and this rim of bone to help release tightness through here. I can usually sink fairly deep into there, especially through this little gap that's in between the two layers of the muscle to help release tightness in there. You know, the ultimate work is actually internal work. Yeah, for both sexes, that means internal rectal work, in which one of the main techniques is to go in rectally and to get a hold of the tailbone and to simply traction downward. That creates a phenomenal release for the tissue all around the tailbone that can start to release up through the sacrum, that can have a very positive benefit to those parasympathetic nerves. And then also any internal and external work to clear out any scar tissue. A lot of us have scar tissue around our tailbone that has a huge benefit to sensation down here, motor control, and then those various important parasympathetic nervous system responses down here. And then obviously for women only, internal vaginal work. I don't do very much of that. Most of my external techniques are more than profound enough for the vast majority of clients. The exceptions would be mostly the people with the severe menstrual issues, fertility issues, stuff like that, where just you have to do internal work. It's an area I did not plan on getting into, but my exposure to techniques from Thailand and then just discovering by doing the external techniques to feel the internal tightness in there, how it's necessary to do stuff. So far with my experience for what internal work I've been able to do, I've started to see phenomenal changes for the severity of the menstrual cycle in women, and then also to actually help reposition the internal parts by being able to do the internal techniques. If the internal lady parts are too shoved forward, compressing and not giving you enough room for your bladder, so you have to pee more often, getting into release tightness to help move parts backward, or how they're twisted, anything like that is so important. You know, whatever your personal modesty levels are, I try to accommodate everyone. Most of what I do is for women's health issues, simply because women are the ones most likely to come in seeking help. You know, when it comes to sexual reproductive health, there's so much more support for women's issues. When it comes to guys' issues, the most that's talked about is, you know, go take a pill for erectile health. So, lots of information there. Trying to keep the video shorter. So far, all I've learned is that I love to talk. Please contact me with any questions, and I look forward to helping you in any way possible. Bye.